Welcome to Module 2. In this module, we will discuss Chapter 3, which is about communication essentials. These are chapter objectives, and we are gonna cover all these objectives listed here throughout this module. First, let's talk about nutrition counseling goals. There are three goals that we want to achieve. First, we want to facilitate lifestyle awareness. This goal can be achieved by focusing on clients, acknowledging their feelings, experience, and behavior, and we also want to provide information to the clients. The second goal is to strengthen healthy lifestyle decision making. This goal can be achieved by exploring feelings, ambivalence, inner strength, behavior, and alternative options. And the third goal, which is our ultimate goal, is to take appropriate action. So we want our clients or our client to take appropriate action to obtain a healthier lifestyle and become self-sufficient. Remember, in nutrition counseling, we are just giving kind of advice to clients. So our clients is responsible for lifestyle changes. And we want to make sure after our counseling session, the clients are going to become self-sufficient. They can rely on themselves to maintain the changes, the behavior changes. There are a couple of stages for skill development as nutrition professionals or nutrition counselors. First, we need to define two terms here, traits and skills. So, traits are inherent personality characteristics or quality of mind. So remember, in this slide, we are talking about ourselves. We are talking about nutrition counselors or nutrition professionals. Each one of us differ in terms of personality characteristics or quality of mind, and that's called traits. And skills is acquired ability to perform a given task. So, as a nutrition professional or counselor, we can learn counseling skills through patience and practice. Remember, practice is very important. Initially, we can seem a novice counselor, but gradually we will develop several skills, and that skill development requires patience and practice. And also, we can learn counseling skills through a sequence of steps which are involved in mastering the skills. So, as I said, we can learn counseling skills through patience and practice. In order to develop a new skill, no matter what skill is that, it can be a skill in performing a task besides counseling, for example, nutrition counseling. So, in order to develop that skill, first we need to have a motivation. We need to be motivated to learn a new skill. And motivation is the first important step in skill development. And then learning. We need to engage in reading, participating in learning sessions, attending several conferences or workshops. We can make observations and all those things. Awkwardness. A degree of awkwardness should be expected when conducting your first counseling session. So, as I said, initially, we may seem a novice counselor without confident, but eventually we will develop counseling skills. And that awkwardness is a natural stage of skill development. Conscious awareness, automatic response, which is the skill, will become an automatic reaction with little or no forethought or discomfort. And proficiency. So these are the stages of skill development. What's the first important step in developing a skill? Practicing regularly without any interest, memorizing techniques, having a desire or motivation to learn, watching others perform the skill. So, number A, the option A, there is no motivation there. Option B, memorizing techniques. This can be helpful, but this is the learning stage of skill development. Option C is the motivation, which is the first important step. And option D is also related to learning, the stage of learning in skill development. Here is the model of communication. So here, words speaker said. So a speaker can be our client, right? Our client speaks with us, talks to us, right? So the words speaker said, the words the client said, what the listener heard. So as a nutrition counselor, what we are listening or what we are hearing from our client, what the listener thought the speaker meant, and then what the speaker actually meant. So this is the model of communication. A speaker's intended meaning can be distorted at three main points or junctures. A faulty encoding process or the inability to express a thought. Distortions also occur when words are not heard properly. A listener can distort a message during the decoding process, which refers to analysis of the thoughts expressed by others. So, in several stages and steps of the model of communication, distortion can happen, mainly at three main junctures. We interpret statements through mental filters created by past experience. This is a very important point. We can interpret the counselor's words through mental filters, and these mental filters can be different from person to person, from counselor to counselor. And it is depending on our past experience. In a counseling session, remember, we are not going to interrogate a client with a series of "what do you mean?" questions. We need to listen closely and consider alternative meanings without interrupting the session. In some cases, we need to intervene and ask questions from clients in the case of we are not understanding clearly what clients say. But it is better to avoid asking a series of what do you mean questions. Because in that case, the client can feel they are they are being interrogated. The closer two individuals share a common culture, the greater the likelihood that distortions will be minimal and conversation will flow smoothly. So we talked about the cultural effects in module 1. So cultural can also influence communication. And here are the cross-cultural um, indicators that can affect communication. Ethnicity, sex, age, nationality, socioeconomic status, health condition, religion, educational background, group membership, gender and sexual orientation, political affiliation. So these are the factors impacting cross-cultural communication. So we need to pay a close attention to these factors when we are uh, counseling a client. And there are some differences among cultural groups regarding body language. So, for example, a person, let's say our client is from an Asian country. Their body language is different from Americans. They can also vary in use of expressive language, degree of directness. So in some cultures, directness is considered rude, being rude, but in some cultures it's not like that. Use of eye contact. For example, for countries like in Middle Eastern countries, making eye contact sometimes convey the meaning of being rude. But in the US, it's not like that. In American culture, it's not like that. And also remember, when we are talking about cultural groups, we are not talking about just countries. Within a state or within a county, we can have different cultural groups, and they can have different body language, degree of directness, use of eye contact, amount of personal space needed, an acceptable duration of silence. These are the key differences among culture groups. There are two types of communication, non-verbal or verbal. And remember, when we are talking to a friend, we also use non-verbal and verbal uh, styles of communication. This is not just uh, like in the case of counseling a client. When we are talking to a friend, to a family member, we have some non-verbal and verbal communication styles. And these are the examples of each style. Guidelines for enhancing counseling communication effectiveness. So, counselors, nutrition professionals, and nutrition counselors use both verbal and nonverbal counseling responses with a specific intent and focus to address counseling objectives. So, when we say counseling intent, it means the rationale for selecting a particular response. And when we say counseling focus, it is the placement of emphasis in a response. Nutrition counselors need to modify some previously learned behaviors, such as talking about oneself, asking many questions, and avoiding being silent during counseling session. So the focus of a response could be placed on information about a client or client's general experience, and that general experience can be subdivided into feelings, thoughts, and behaviors, just like we see from the figure. Counseling model has three intents or rationales: to acknowledge, to explore, and to challenge. So to acknowledge, responses would be selected that identify observations, affirm, show respect, or recognize the worthiness of a client. Relationship building responses would be fall into this category. To explore, information, thought, and experience focus. So our response to clients could be to explore ambivalence, consider new information, or gain insight. We can do this by asking questions, providing information, or make clarifying responses. And also, we can challenge our clients. We can respond to our clients and challenge them. And that challenge notes a discrepancy in clients' statements. So here are some examples from your textbook. So for example, the first example is your blood evaluation indicates that you have a cholesterol level of 330. Your dietary evaluation shows a high intake of saturated fat and sugar and a low intake of fiber, fruits, and vegetables. So in this case, we are giving information to our clients. So our response will fall into explore. How did you handle the party last week? This is also exploring. We are asking about client's experience. You have a right to feel angry about having to handle another dietary modification. We are acknowledging our clients. I'm getting the impression that you are thinking that you are a bad person because you ate a lot of cheese at the party. This is also exploring. We are asking about the thoughts of a client about eating cheese. You set a goal to limit your intake of cheese to 1 ounce a day, but at the party you found this challenging. We are exploring the behavior of our client. So this is kind of intent to challenge our client. We see a discrepancy here because client set a goal to limit the intake of cheese, but at the party, the client found it challenging. So this is a discrepancy. The majority of our communication to a friend, to family member, to client, up to 85% is based on tone of voice and body language. And there is a phrase here: actions speak louder than words, which kind of signifies the importance of non-verbal behavior during a communication. When we develop a skill for non-verbal behavior, actually we are creating an environment conducive to the development of a trusting relationship. So in order to make a good relationship with clients, We have to develop nonverbal behavior skill. And whenever we have unproductive nonverbal behavior, the communication will be hampered, including frequently looking at a watch, yawning, tapping or swinging feet, or playing with hair or a pencil. A counselor's joyful expression or attentive silence can communicate an understanding of a client's emotional state. So, nonverbal behavior, nonverbal communication, it's very important. And we have to develop a skill in order to have a good nonverbal behavior. And remember, we can develop these skills, verbal and nonverbal communication skills, by being patient and by practicing. So this is nonverbal mode of communication. For example, the distance between counselor and the client, our posture, our gesture, eye contact, facial expression, volume of voice, tone of voice, rate of voice, and our energy level. These are all non-verbal behavior factors. We have to, again, there are two types of communication, verbal and non-verbal. We need to harmonize our verbal and non-verbal behavior. So synchrony is body language, harmony between two people. It is called synchrony. Mirroring and matching a client's body language have been advocated for business and sales personnel as a way to increase sensitivity and establish rapport. So, but in the era of in the area of nutrition counseling, it has been it has been studied that when we harmonize our verbal and nonverbal behavior, and whenever we mirror and match our body language with our clients, it has a great effect on developing a healthy relationship with client. A counselor mirror a client's silent behavior for those who are culturally accustomed to long periods of silence. So here's an example. So if our client is culturally used to being silent for a long period of time, we can mirror this behavior if we are aware of the culture of our client, we can mirror this silent behavior in order to make a good relationship with client. And in order to avoid feeling overwhelmed when learning this strategy, we have to select one aspect of client's behavior to mimic. And remember, if we want to select more than a couple of behaviors of clients to mirror, sometimes clients can feel we are mocking them, we are making fun of them. When clients are agitated or distracted, we can shift to a more attentive and focused manner. We have to interpret our client's body language. Clues regarding a client's feelings can come from our client's body language. For example, we have like sweaty palms, flushed face, and so forth. These are all expressions of autonomic nervous system reactivity. Habit and culture complicate the overall task of interpreting nonverbal behavior, which is obvious. Culture of clients and their habits, they make it very complicated in order to interpret our client's body language, for example. And no single aspect of nonverbal communication can be universally translated across all cultural groups. As I said, for nonverbal behavior, for example, eye contact or nudging the head, all those different types of body language have different meanings in different cultures. For example, in some cultures, nudging the head side to side means yes, or in some cultures it means no. So this is an example. And we cannot just interpret those types of body language the same way as people from different cultures. And if you are unsure of a particular behavior, you can ask. You can ask your clients. For example, I noticed that you are mostly looking down. Would you tell me what that means for you? So this is an example. Sometimes we don't need to be silent throughout the counseling and just listening to clients. If we are unsure of a particular behavior from our client, we can just ask them. Can ask them, can you please explain what that means when you are looking down, for example? Or if they trying to look at their watch several times, we can just ask them. We can also use some communication roadblocks, but we use them only when justified. So communication roadblocks are obstacles that counselors inadvertently put up that block self-exploration. It happens, communication roadblocks happen when counselors impose their own views, feelings, opinions, judgments, prejudices, frequently made with good intentions and are not meant to block communication. So here are examples of roadblock. So let's say the response is ordering, directing, or commanding. Example is, don't say that. Go right back and tell her. This is a kind of a communication roadblock. Giving advice, making suggestions, or providing solutions. The example for that response is what you need to do, and so on and so forth. These are different examples of communication roadblocks. Empathy is very important. It is the core of an effective counseling relationship. It depends on our ability to experience and show empathy. And remember, empathy is different from sympathy, and we will talk about that. We need to demonstrate empathy on the first meeting and at the beginning of each session. And empathy is true understanding of another's unique perspective and experience without judging, criticizing, or blaming them. This is the definition of empathy. And empathy should be effectively communicated both verbally and non-verbally. We can show empathy both verbally and non-verbally. It requires the ability to hear and sense the experiential world of that person. So, as I said, empathy is not sympathy. Sympathy is what I feel toward you. Empathy is what I feel as you. Empathy is what I experience as you in your shoes. Empathy is much more than putting oneself in the other person's shoes. Empathy requires a constant shifting between my experiencing as you what you feel and my being able to think as me about your experience. So empathy is also very effective skill and we have to work on this. And please make sure you are not showing sympathy but empathy. Counseling responses are geared to accomplish three objectives: to develop productive relationships, to enhance listening and exploring to understand clients' messages, for example, their needs and concerns, and to provide the tools to utilize motivational strategies. And there are 16 responses. There are 16 counseling responses have been identified as being useful in the healthcare arena. Attending or active listening is the most basic skill on which all other counseling skills are built. And when we say attending or active listening, it means listening for verbal messages and observing non-verbal behavior. It is what you see and hear, not what you know. It has four key components. Eye contact, making eye contact. We need to refrain from staring and permit natural breaks. We need to pay attention to client's body language, the vocal style, like speech rate, volume, and tone, and verbal following. For example, we need to give brief verbal and non-verbal responses, such as nods or an occasional or yes, I see. So these are examples for showing we are actively listening to our clients' statements. Reflection is labeling a client's expressed verbal and non-verbal emotion. It helps the client. By reflection, we are emphasizing, and reflection helps the client to feel understood. It facilitates self-acceptance and self-understanding. There are a couple of steps which will help us reflect more effectively as we communicate with our clients. Critically identify the feeling being expressed, like anger, fear, conflict, sadness, and happiness. Remember, we have 5 major feelings, including anger, fear, conflict, sadness, and happiness. And in order to identify these feelings, for example, if our client is anger or fearful, sad or happy, in order to identify these feelings, it requires careful listening and close observation of nonverbal behavior and voice quality. Because the voice quality differs from being anger or fearful, being sad or happy. When we are sad, we have a different voice quality. When we are happy, we have a different voice quality. Reflect the feeling you have identified to the client. So, for example, we need to drop the tone if your voice, drop the tone of your voice at the end of the statement. Otherwise, it will indicate like we are asking a question from our client. And we need to match the intensity of our response to the level of feeling expressed by the client. And we need to respond to the feelings of our client, not to the feelings of others. For example, if client says, my sister or my brother is angry with me about eating cheese at the party, we need to reflect on our client statement, not reflecting on client's brothers or sisters' statement. We don't have to reflect or respond to client sister's angerness or like being anger. The third group of counseling responses is legitimation or normalization. Reflection responses involve, sorry, identification and acknowledgement of a client's feeling. By legitimation or normalization, we are kind of like saying that your feeling or your, for example, experience is totally normal. So we, as a counselor, we need to acknowledge that this is normal to have such feelings and reactions. This is normalization or legitimation. And usually it is a good idea to receive verification that you have correctly identified your client's feelings before making a statement that the feelings are legitimate and make sense to you. And again, whenever you are unsure of a particular behavior, you can just ask them for clarification. Respect, being respectful, showing respect for our clients' abilities by being active listener and through nonverbal behavior. Explicit statements of respect show genuine appreciation for the worth of the client and can help build a rapport or relationship between counselor and client. It increases confidence in the ability to cope with difficult conditions. So, respect or affirmation responses include words of appreciation on the ability to overcome adversity and adjust to difficult situations, helping clients recognize their strengths and capabilities. Affirmations are not the same as compliments or praise, which have a tone of judgment or evaluation. Avoid the use of I in an affirmation response. For example, I should avoid saying I praise you, or I'm proud of you for making this change in your lifestyle, for example. I need to avoid using I. Otherwise, it can have a tone of judgment or evaluation. We need to show a personal support. Our clients should know you want to help. We want to help them. And those statements of personal support will create an effective relationship between us and our clients. Partnership. We can say, I'm here and I'm going to work with you. We are going to collaborate on doing these changes. So this partnership means the client and the counselor respect each other and work together to find solutions. And mirroring, as I said before, so mirroring responses are repeating back to a client exactly what was said or with few words changed. By doing that, by mirroring, we are letting our client know that we are listening. This behavior, this response encourages the person, the client, to keep talking and exploring. And care should be taken not to overdo this response, or else your client is likely to talk less. And the paraphrasing or summarizing is kind of rephrasing or paraphrasing of the content of what the client said and meant. Again, by doing paraphrasing or rephrasing or summarizing, we are letting the client know that we are listening. And it encourages clients to continue talking. So these are some examples of paraphrasing or rephrasing or summarizing statements. For example, what I hear you saying is, let me see if I understand this correctly. So what you are thinking is, so here we are kind of summarizing the client's statements. And by doing that, clients know that we are listening carefully. We are paying close attention to their statements. And we can give feedback to clients. So we can tell our clients what we have directly observed about their verbal and nonverbal behavior. And here are three main guidelines for giving feedback. We need to be positive and specific. We need to note behavior, not traits. Again, traits are the quality of mind, their personality characteristics. We don't have to, and we shouldn't give feedback to clients' traits. We should give feedback to clients' behavior. And we should not put the client on the defensive stage. So here are examples. When you said you wanted to give up drinking so much coffee, you looked sad. Here we are giving feedback to our client's non-verbal behavior. I noticed that you started to wring your hands when you started to talk about your blood pressure. Again, we are giving feedback to our clients about their non-verbal or verbal behavior. Questioning. We can ask questions from clients to gather information. This questioning can encourage clients to explore and changing the focus of the discussion. Questions should be asked only if there is a particular therapeutic purpose in mind. They interrupt concentration and lead to a discussion of concerns that interest the counselor but not necessarily the client. So here are some useful questions. We can use closed-ended questions, which is useful for ending a lengthy discourse or for soliciting a specific answer. We can ask open-ended questions. And these questions are preferable. These questions can lead to rambling, lengthy answers, not just like saying yes or no. And funneling questions. We can start questioning a very wide topic, and then we can narrow it down to a specific item. That's funneling questions. And here are some problematic questions. Why questions? We need to avoid asking why questions because they often sound judgmental and they can put the clients on the defensive. Multiple questions. By answering multiple questions, we are making our clients confused. They are confused, uh, trying to decide which question to answer first. And also, we should avoid question answer traps, which is a series of questions leading to feelings of being under interrogation. And this also can lead to defensiveness, leading to half-truths, protecting self-esteem. It's saying that no more than 3 questions in a row should be asked. And we can also clarify, which encourage clients to continue talking about their concerns in order to be clear about their feelings and experiences. So, for example, we can say, tell me more through body language such as nods of the head or short comments like or go on, and use trailing words such as and or and then or the last few words spoken by your client. We can ask clarifying questions like, can you explain that in a slightly different way? Anything else? And to challenge the client when we are noting a discrepancy. We can confront them and we can challenge them. So we can use different statements like state observation without but or state observation with but, use on one hand, on the other hand expression. And we can also name the discrepancy. And we can directly name it. For example, I can say, I see an inconsistency. I'm hearing 2 things at once. And directing or instructions. The directing response is telling a client exactly what needs to be done. In nutrition counseling, directives are often important components of the educational portion of a session. So this happens at the end of the nutrition counseling session when we are giving instructions to our clients to make a lifestyle or behavior change. We can direct them. We can tell them exactly what needs to be done. We have to be clear and concise. Otherwise, the clients can get confused and not understand the instructions. And we can also ask the client to repeat back the instructions to make sure that they understand the instructions accurately and clearly. and advice. We can provide some possible solutions for problems. And in order to be effective, our advice need to be effective. And advice should be given in a non-judgmental manner, identify the problem, explain the need to change, advocate an explicit plan of action with options if possible, and end with open-ended question to elicit a response from client. Advice should only be given when there is a clear understanding of the problem. When we understand the problem clearly, then we can give advice. Previous attempts to deal with the difficulty have been investigated. The counselor has definite ideas for possible solutions. Silence during a counseling session is not a bad thing. Sometimes it is a valuable tool for being silent. So, being silent and listening, actively listening to the client, it's very important during a counseling session. We can ask an open-ended question from a client and then be silent and just listening to the client's statements. We can also have self-referent or self-disclosing and self-involving. So the counselors, such as us, can shift the focus to ourselves in support of the client and the therapeutic relationship. So we have two types of self-referent or self-disclosing or self-involving. Self-disclosing response provides information about the counselor that is generally related to coping experience. Self-involving responses actively incorporate a counselor's feelings and emotions into a session. So, what technique is used by the counselor in the following conversation? Client: I had chocolate hidden under my bed. And the counselor can say, you had chocolate hidden under your bed, sounding moderately surprised. So here we have reflection, legitimation, affirmation, or mirroring. So we are kind of mirror our client here. So for example, client says, I had chocolate hidden under my bed, and we say, you had chocolate hidden under your bed. So we are mirroring the our client statement.